Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Carcinoma of the stomach and the risk factors. So first is the dietary. Under dietary, there can be the low fat or the protein consumption. So low fat or the protein consumption. Next is the consumption of the salted meat. So the salted meat or fish with a high nitrate content, with a extremely high nitrate content. Then comes the high complex carbohydrate consumption, high carbohydrates consumption. Then is the smoking or the alcohol, spicy food or the high salt diet. Then comes the lack of fresh fruits and vegetables. Lack of fresh fruits and vegetables. Lastly, there is a dietary antioxidant deficiency. Antioxidant deficiency. Next, we look into the genetic and the familial. So here there is E. cadherin. E. cadherin. So in E. cadherin, the hereditary diffuse type of gastric cancer. It is the hereditary diffuse type of the gastric cancer, and even in terms of blood group A, BGA, then FAP, as well as the Lee-Frommeny syndrome. Next is the HNPCC as well as the BRCA2 mutation. Next, we look into the pre-malignant lesions. So in the pre-malignant lesions, there is the chronic atrophic gastritis, and there is the adenomatous polyp, that is the FAP, then pernicious anemia, intestinal metaplasia, so here the causative organism is the H. pylori, then the Meniere's disease, Menetrier's disease, and the stump carcinoma from the carcinoma to the stomach remnants in Billroth 2. So the stump carcinoma from the stomach remnants. This is in terms of the Billroth 2 GJ. Billroth 2 GJ or the vagotomy GJ. Now we look at the others. The other conditions it includes. They include the lower socioeconomical status. Then in terms of the male gender and the rubber and coal workers. Also the EBV infection. To learn and grow daily like this, please do subscribe.